So in medical school, I was convinced I wanted to be a diagnostic radiologist. Oftentimes, the diagnostic radiologist will read the images and almost like Sherlock Holmes, come up with a solution to what the images show. That's kind of where their interaction stops with the patient, and I really wanted to take that to the next step. I'm Anna Ohlsson. I'm a vascular surgeon. I am the director of the Venous Disease Treatment Program here at Penn Medicine. I'm a venous specialist. I am trained broadly in vascular surgery, which is the treatment of all blood vessels, arteries, and veins. And the veins are important at returning blood flow back towards the heart. Venous disease tends to be more day-to-day kind of discomfort, swelling, problems like that. And certainly they're serious issues, but usually it's more something that's impacting somebody on a day-to-day basis rather than an acute emergency. When patients present to me, they often will have symptoms of swelling or heaviness, fatigue in their legs, or symptomatic veins in their legs. They'll notice it if they've been standing all day or sitting all day, that in general their legs are uncomfortable. So there is a variable amount of ways they can present, but sometimes people also don't have any symptoms from their veins. You can see people who have visible veins or have had imaging studies that demonstrate there's some dysfunction in the veins, but they don't necessarily have the same symptoms. Usually when I start a patient visit, I leave it very open-ended. I want to hear from them what their concerns are. I very actively listen to what they tell me and let them kind of lead the discussion at first. I'd say there are a lot of exciting things going on in my field right now. There's been a lot of research and treatments dedicated at trying to improve flow in the deep veins. You're constantly learning about those new techniques and new ideas, which is fascinating. I think the best part of my job is having patients come back and seeing how they're doing after procedures or interventions and seeing their faces light up. I'd say my inspiration for providing patient care is absolutely my mentors. I've been honored to learn from really incredible people in the field. No problem is too small, no problem is too large. Understanding that the patient is there for help and you need to just listen.